Hi everybody, it's Michelle here again with birthuhura. Here at birthuhura, I am a full spectrum plant-based holistic doula and an advocate for all things safe, natural, and effective. Here on this channel, we discuss all things pregnancy, birth, and womb health related. So if you guys like the content, you love what you hear on the channel, please be sure to subscribe. Today's topic is going to be about epidurals, and I want to talk about this because a lot of times in Western society, we are opting for epidurals and we do not understand everything that involves this form of pain management. First of all, by the time we are at the point when you would need an epidural, you are in so much pain that you're not trying to hear nothing they talk about. You don't want to hear about the risk. You don't want to hear about, you just like, can you give me the medicine, please? I want the epidural. But here is the thing about epidurals that kind of just blow my mind, because I'm hearing a lot of nurses, and I've done quite a few hospital births, and the nurse will tell mom and family that the epidural, the medication and the epidural would not pass to the baby. Absolutely incorrect. First of all, there is a narcotic in the epidural, fentanyl. This is a drug. This is an opioid. This is a narcotic that will pass and can pass through to your baby via the placenta. This medication is going right through the spinal cord, through your bloodstream, which you share with your baby. And you're going to tell me to my face and to my client's face that, oh no, the medicine doesn't pass to the baby. It only just goes from the waist down the surface. Like, it just takes the edge off of the pain. You know, the pain off of the contractions. It takes the edge off. And I'm like, hold on, let me go to my bag and get the paperwork and the studies that I have that say otherwise, because this is incorrect information and it's not informed consent. It's not. Woman needs to know every single risk associated with what's going on, what medical procedure is happening to her. She needs to know. Ideally, I say inform her in the beginning stages, because like I said, by the time you get to the point where you actually even are, you're considering the epidural, you're in agony and you don't want to talk to them. You don't want to hear nothing. You just want the pain to stop. And this is most hospital births, because we're laying in the bed, we're not in the right positions, we're not being supported properly, and we just want it to be done, especially if we're having a long labor. But my thing is too that this is something that they will tell you, is that the epidural will cause low blood pressure. I have experienced this multiple times personally with my clients, that it will lower your blood pressure and it will lower your baby's heart rate. Here is the thing. This will cause for them to say, baby is not being stabilized. You need medication to keep your blood pressure up. We have to hurry up and get this baby out of here. We need to get you into surgery and have this baby be a C-section because you are in danger. As a doula, I am just giving this suggestion for other doulas because I have found this to work for me. It is difficult. It's going to be difficult. It's going to require a lot of hands-on work. But I have manually kept my client's blood pressure up by lifting their legs up, and as I'm standing at the edge of the bed, putting their legs on my shoulders and kneading the blood, moving the blood through the body. I also have a body massager where I will massage their, it's battery operated, so it vibrates. But I will massage their body. I will turn them. I will have them I will pull them to the one side, pull them to the other side, but I keep them moving, because when you are idle and you have that epidural in your spine, your blood pressure is likely going to drop. When your blood pressure is dropping, it's affecting your baby's heart rate, it's affecting your baby's blood pressure as well. This is not ideal. You don't want this to happen. Now, another thing that the epidural could cause: nausea, vomiting, fever. It's crazy to me that they say, oh, the cause of this is unknown. Well, in theory, what I'm going to think is happening is that the epidural is compromising your immune system. And the hospital is full of germs. The hospital is full of bacteria, pathogens, everything. And if you are, you have this medication in you and you can't, your body can't fight these things. Again, this is not medical information. This is my theory. Just, for you, if it makes sense to you, it makes sense to you. If you don't connect with it, you don't. But if the epidural seems to cause fever in 27% of women, then we have to start looking at what it does to the immune system. And also, what is it going to do after I have my baby and I'm in the postpartum stage, after I have depleted my body of all of this stuff? A good thing for fevers, I always keep cantaloupe with me when I'm with my clients, because I swear by cantaloupe. I love cantaloupe. It is very high in mineral C. It's a cooling fruit, and so in my opinion, it will help keep the fever away. Obviously, other things like infection, because anytime you're sticking something through your body is a risk. But epidurals are not ideal. When your baby comes out after having an epidural, your baby is likely going to be drowsy, likely going to be not as responsive as he or she could be because of the medication, not breastfeeding properly, sleeping a lot. All of this is due to the narcotic. And this affects how you and baby bond together. This is affecting how you are now being able to produce your milk. This is affecting suckle effect, being able to, get a good latch. All of this is being affected. And then we're left with mom saying, I failed. My baby wouldn't latch. It's my fault. All of these different things, when in actuality, you were just not informed properly. And if you give it a little bit more time and a little bit more patience, you can do it, and you will do it if that's what you choose to do. But the epidurals is not the way to go. Also, laying on your back is not the way to go. You need to be moving around. You need to be mobile. You need to be free to, get your blood flowing, circulating, intentional movement, breathing that baby out, breathing that baby down. Be supported by your team. It's so much other ways to deal with the pain other than I just want to take the pain away altogether. It's temporary. You can get through those 60-second contractions. It is not going to last forever. But that back pain from the epidural will last forever. Those effects that could come from it, nerve damage, that can last forever. So just be mindful of what you are doing and how you are doing it, and the decisions that you're making based off of someone saying, it's safe and it's not going to bother your baby. And we have women coming in epidurals all the time. We have the best anesthesiologists and all of these different things. That means nothing, because one wrong move is your life. One wrong move is your baby's life. One wrong turn, the risks are just too big, in my opinion. And that's just my take. So if you guys want to talk more about it, drop a comment, drop your experience with, maybe you have experience that you would like to share with other people that may help them determine whether they may or may not get one. But yeah, let's, build this community and really just try to help educate one another. And even if there's something that you want to, point out, if maybe I said something or whatever, I'm open. I'm always open. I'm most open to learning new information. But again, I'm Michelle. I'm a full spectrum holistic doula at birthuhura. And if you guys need to drop a topic, please email me at birthuhura@gmail.com. And I will see you guys for the next video. Thank you so much. Peace and pregnancy dust.